From that, today is International Day to End Obstetric Fistula, celebrated on the 23rd of May, and that's to create awareness on childbirth injury resulting from prolonged and obstructed labor. According to the United Nations Population Fund, obstetric fistula occurs annually, leaving women with leaking urine, feces, or both, and often leads to depression, social isolation, and 90% of pregnancies involving fistula end in stillbirth. This year's theme, Breaking the Cycle, Preventing Fistula Worldwide, underscores the urgent need to address obstetric fistula comprehensively, emphasizing equitable access to quality maternal health services, social reintegration, and sustained investment in healthcare systems. Now, for more insights on this, let's speak to a public health physician, Mariam Oshodi, who joins me via Zoom. Thank you so much for joining us, Dr. Oshodi. We keep hearing about this, but just explain to us what exactly it means. What is obstetric fistula, and what are the leading causes of this condition?
Okay, thank you. Good afternoon. Obstetric fistula is a devastating childbirth injury and is one of the neglected public health issues. It's actually a hole or an abnormal opening between a woman's birth canal and her bladder or rectum, as the case may be, or both. And it is directly linked to one of the major causes of maternal mortality, that is prolonged obstructed labor. Over 98% of cases of obstetric fistula occurs as a result of obstructed labor. And that is one major issue that we need to address. And obstructed labor is basically a woman that is in labor for greater than 24 hours. And one of the major causes there are several causes of obstructed labor actually, but one of them also include poor access to medical care, lack of skilled birth attendant at delivery, and then also some harmful traditional practices which are still common, and then also having early childbirth. So people having teenage pregnancy, early childbirth, and also indirectly caused by poverty, poor education of women, because they are not enlightened that they need to know that once I'm in labor, I need to get to the hospital, and not just any hospital. You need to get to an hospital that you can have emergency obstetric care. And what I mean by emergency obstetric care, you need to be in an hospital where if a vaginal delivery is not able to pull through, there can be room to have an emergency cesarean section. So the delay in having that intervention will lead to prolonged obstructed labor, which will make someone come up with obstetric fistula.
All right, but then we all also know that already a number of people live with this condition. What can be done to help these people? Can it be treated?
Yes, it can be treated. So for people, quite a number of people live with this condition, and for those, it's a very traumatizing situation because the woman or the affected person is constantly draining either urine or feces, as the case may be, and so there is a shame. They have this offensive odor, which no one wants to stay near them. So you can have people that are married having an offensive odor, and then also, of course, some of them eventually get divorced because the husband cannot stand the smell, and their in-laws that they're not supportive and all that, and then the whole their marriage is affected. Also, even if they don't have family support, having someone that stinks with urine and feces around comes with so much shame. The societal stigma is very bad. They tend to go to depression. Their mental health is affected, and it goes a whole lot more. And then, so for people that have this kind of condition, yes, it can be treated. Surgical intervention is the ultimate treatment for anyone that has the obstetric fistula, and that will be done at a tertiary facility specialist, and it will be done in stages. It's not just one procedure. There will be lots of there'll be regular preparations that will be carried out for people that have such condition, and it can actually be healed. So for people that have that kind of condition, first thing is support. Please, no stigmatization. We need to stop stigmatizing people with any form of medical condition, as the case may be. And then it's also very important that they seek for the proper health care. Because, yes, we know that we're still very much traditionally oriented in this part of the world. So people still go and continue with harmful traditional practices that would not help the management. And then it's also very important is to have support groups. So there'll be other people that might have this condition. It's important to have support system, even at home. Likewise, in course of management. So we have several non-governmental organizations that come up with support for people that are living with fistula.
All right.
And then they're able to help them improve their standard of living.
All right. And for the treatment itself, really, I'm wondering how affordable and accessible it is.
Well, yes, it's quite available. Let me use that word first. Then affordability. Affordability is relative because, like I said, it's stage wise, and so it might be at quite a cost that might be hard for or difficult for some people to afford. However, there are quite a number of non-governmental organizations that support women living with obstetric fistula to aid their treatment and management.
All right, Dr. Oshodi, thank you so much for speaking to us on this very important matter today. Public health physician Mariam Oshodi, thank you.
You're welcome.